Have you ever felt like there's something stuck in your throat? But no matter how many times you swallow, cough, or clear your throat, it simply refuses to go away? Maybe you're constantly saying ahem during conversations. Maybe you wake up every morning with thick mucus coating the back of your throat. Maybe you've tried hot tea, cough syrups, lozenges, even antibiotics. And yet the feeling keeps coming back. Here's something that surprises many people. In many cases, the mucus isn't actually the real problem. That's right. What feels like excess mucus is often your body's response to something else that's been quietly happening for weeks, months, or even years. And until that hidden cause is identified, no home remedy or temporary treatment will provide lasting relief. What's even more concerning is that millions of people assume it's just allergies, a cold, or simply getting older. They continue clearing their throat dozens, sometimes hundreds, of times every single day without realizing that this habit can actually irritate the throat even more. Even more surprising, some of the most common causes have nothing to do with the lungs. They can begin in your nose, your stomach, your environment, even some of the medications you take every day. Today, we're going to uncover what medical professionals know about persistent throat mucus, why it happens, why so many people treat it the wrong way, and most importantly, what you can do to finally reduce that annoying sensation. We'll also discuss several warning signs that many people ignore but should never overlook because, in some situations, persistent mucus can be a signal that deserves proper medical evaluation. One of the causes, we'll discuss near the end, is responsible for symptoms in countless people who have absolutely no heartburn at all. Most people never suspect it because it doesn't feel like acid reflux, even though that's exactly what's happening. So if you've been struggling with constant throat clearing, postnasal drip, or that irritating lump in the throat feeling that never seems to disappear, stay with us until the very end. Some of what you're about to learn may completely change the way you think about this everyday problem. Many people believe that if they constantly feel mucus stuck in their throat, their body must simply be producing too much mucus. It seems like the obvious explanation. After all, if you can feel it, cough it up, or keep swallowing it, then surely there must be an excessive amount. But this is one of the biggest misunderstandings surrounding this very common symptom. The truth is that mucus itself is not the enemy. In fact, your body depends on it every single day to stay healthy. Every breath you take exposes your nose, throat, and lungs to tiny particles floating through the air. Dust, pollen, bacteria, viruses, smoke, countless other macroscopic irritants are constantly trying to enter your respiratory system. Mucus acts as your body's natural protective barrier. It traps these unwanted particles before they can reach deeper into your lungs, where they could cause much more serious problems. Your mucus also keeps the delicate lining of your nose, throat, and airways moist. Without it, these tissues would dry out, become irritated, and lose much of their ability to defend against infection. In other words, mucus is not something your body accidentally makes. It is something your body carefully produces because it is essential for your health. Under normal circumstances, your body produces a surprising amount of mucus every day. Most people don't realize this because they never notice it. Tiny hair-like structures called cilia continuously move mucus from your sinuses and airways toward the back of your throat, where you automatically swallow it without thinking. This process happens around the clock and is a completely normal part of healthy breathing. So why does it suddenly feel like there's mucus constantly stuck in your throat? In many cases, it isn't because you're producing dramatically more mucus. Instead, the mucus may have become thicker, stickier, or more noticeable. Sometimes the amount increases slightly. But the real issue is that it isn't clearing as efficiently as it normally should. Even a small change in mucus consistency can make it cling to the back of the throat, creating the persistent sensation that something is always there. This is why so many people say, "I can never clear my throat completely." They cough, swallow, drink water, and clear their throat repeatedly. Yet the feeling returns within seconds or minutes. That's because the underlying cause hasn't been addressed. Another important point is that the sensation of mucus doesn't always match the actual amount of mucus present. The throat is an extremely sensitive part of the body. Even mild inflammation can make normal mucus feel excessive. Imagine wearing a small pebble inside your shoe. The pebble may be tiny, but because your foot is so sensitive, it feels impossible to ignore. The same principle applies to your throat. A little irritation can make perfectly ordinary mucus feel thick, heavy, and constantly noticeable. This explains why two people can have nearly identical amounts of mucus, yet one notices it constantly while the other never thinks about it. One habit that often makes matters worse is frequent throat clearing. It provides a brief sense of relief, which is why people do it over and over again. However, repeated throat clearing creates friction that irritates the delicate tissues lining the throat. That irritation can stimulate even more mucus production and make the throat feel increasingly sensitive. Over time, this can create a frustrating cycle. You feel mucus, so you clear your throat. Clearing your throat causes irritation. The irritation makes the sensation stronger, leading you to clear your throat again. Many people don't realize they're doing this dozens of times an hour. It becomes almost automatic. Family members may notice it before the person does. At work, during phone calls, or while watching television, a constant ahem becomes part of everyday life. Hydration also plays a larger role than most people expect. When your body doesn't have enough fluids, mucus naturally becomes thicker. Thick mucus moves more slowly through the airways, making it much easier to notice. This is one reason many people find their symptoms worse after sleeping, during long airplane flights, or after spending hours in air-conditioned or heated environments where the air is especially dry. Age can also contribute. As people get older, natural changes in mucus production and the efficiency of the cilia can make mucus clearance less effective. That doesn't mean persistent throat mucus should simply be accepted as a normal part of aging, but it does help explain why the symptom becomes more common over time. The most important thing to understand is that persistent throat mucus is usually a symptom, not a diagnosis. Your body is often responding to something else that's causing irritation or inflammation. Rather than asking, how do I get rid of the mucus? A much better question is, why is my body making me notice this mucus in the first place? Once that question is answered, the path toward lasting relief becomes much clearer. One of the biggest reasons people struggle with mucus stuck in their throat for months, or even years, is that they focus on treating the symptom, instead of identifying the cause. Persistent throat mucus is not a disease by itself. It is your body's way of signaling that something is irritating the lining of your nose, throat, or airways. Understanding the most common medical causes can help explain why the problem keeps returning despite trying cough drops, syrups, or home remedies. One of the leading causes is postnasal drip. This occurs when mucus produced in the nose and sinuses drains down the back of the throat, instead of flowing normally through the nostrils. Everyone experiences this to some degree because it is a normal function of the body. However, when the nose becomes irritated or inflamed, it can produce thicker or larger amounts of mucus, making you much more aware of it. Instead of noticing a runny nose, many people simply feel as though something is constantly sliding down the back of their throat. They may swallow repeatedly, clear their throat often, or wake up in the morning with a need to cough. Seasonal allergies are one of the most common triggers of postnasal drip. Pollen, grass, mold, dust mites, and pet dander can all stimulate the immune system to produce extra mucus as a protective response. Some people only notice symptoms during certain times of the year, while others experience them year-round because they are reacting to indoor allergens. In these cases, the mucus itself is not the primary problem. The underlying allergic inflammation is what keeps driving mucus production. Another very common cause is chronic sinus inflammation. When the sinuses become swollen due to allergies, infections, or ongoing irritation, mucus may not drain properly. Instead, it pools inside the sinus cavities before eventually dripping into the throat. People with chronic sinus issues often describe a feeling of pressure around the cheeks, forehead, or eyes, along with congestion that never seems to completely disappear. They may also notice a reduced sense of smell or frequent headaches. Even after a cold has resolved, lingering sinus inflammation can continue producing mucus for weeks. Perhaps one of the most overlooked causes is acid reflux, particularly a form known as silent reflux. Unlike the classic type of acid reflux that causes heartburn, silent reflux may occur without any burning sensation in the chest. Instead, stomach acid or digestive enzymes travel upward into the throat and voice box, irritating tissues that were never designed to handle acidic contents. In response to this irritation, the throat produces extra mucus in an attempt to protect itself. People are surprised to learn that their persistent throat clearing, hoarse voice, chronic cough, or sensation of a lump in the throat may actually be related to reflux, even if they have never experienced traditional heartburn. Dry air is another factor that often goes unnoticed. During winter months, in air-conditioned buildings, or in homes with indoor heating, the air may contain very little moisture. Dry air can remove moisture from the lining of the nose and throat, causing mucus to become thicker and stickier. Instead of moving smoothly, it clings to the back of the throat, making it feel as though it never goes away. This is one reason many people notice worsening symptoms first thing in the morning after sleeping in a dry bedroom. Dehydration has a similar effect. When the body lacks adequate fluids, mucus naturally becomes more concentrated. Thick mucus is much harder for the tiny cilia, lining the airways to transport efficiently. Even mild dehydration can make normal mucus feel excessive. Drinking enough water throughout the day helps keep mucus thinner and easier for the body to clear naturally. Certain medications can also contribute. Some blood pressure medications, antihistamines, antidepressants, and other commonly prescribed drugs may dry out the mouth and throat or alter mucus consistency. People often assume the medication couldn't possibly be related because the symptom developed gradually over time. However, medication side effects sometimes appear slowly and may not be immediately connected to throat discomfort. Smoking remains another major cause of chronic throat mucus. Cigarette smoke damages the tiny cilia, responsible for clearing mucus from the respiratory tract. As these microscopic cleaning mechanisms become less effective, mucus begins to accumulate. At the same time, the chemicals in tobacco smoke irritate the airways, encouraging the body to produce even more mucus as a defense mechanism. This combination often leads to the familiar chronic cough and frequent throat clearing seen in long-term smokers. Respiratory infections can also leave behind lingering mucus, even after the main illness has resolved. Following a cold, influenza, or other viral infection, the lining of the airways may remain inflamed for several weeks. During this recovery period, mucus production may stay elevated while the tissues slowly heal. Many people worry that they have developed a new illness when, in reality, their airways are simply taking longer to recover. Less commonly, persistent throat mucus may be associated with conditions such as asthma, chronic bronchitis, nasal polyps, or structural problems affecting the nose and sinuses. In rare cases, ongoing symptoms may signal a more serious condition that requires medical evaluation, particularly if accompanied by coughing up blood, significant weight loss, difficulty swallowing, persistent pain, or a voice change lasting several weeks. The key message is that mucus itself is usually doing exactly what it was designed to do, protecting your body. The real challenge is discovering what continues to trigger that protective response. Once the underlying cause is identified and treated appropriately, the constant sensation of mucus trapped in the throat often improves far more effectively than simply trying to suppress the mucus itself. One of the most frustrating aspects of persistent throat mucus is that many people unknowingly make the problem worse while trying to fix it. These habits often provide temporary relief, but they fail to address the underlying cause, and, in some cases, actually increase irritation. This creates a cycle where the symptom never truly goes away, leaving people feeling as though they're constantly battling the same problem day after day. Perhaps the most common mistake is repeatedly clearing the throat. Almost everyone does it occasionally, but when mucus feels constantly stuck, throat clearing can become almost automatic. You may not even realize how often you're doing it. Some people clear their throat every few minutes throughout the day. Others do it during conversations, while driving, watching television, or even while trying to fall asleep. The problem is that throat clearing is surprisingly forceful. Every time you do it, your vocal cords slam together, and the delicate tissues lining your throat experience friction and irritation. While this may briefly remove a small amount of mucus, or make the throat feel clearer for a few seconds, it also inflames the tissues. As the irritation increases, your body responds by producing even more protective mucus. Soon, the sensation returns, prompting another round of throat clearing. Before long, you've become trapped in a self-perpetuating cycle. Many people describe it as feeling impossible to stop. The urge becomes almost like an itch that must be scratched. Unfortunately, giving in to that urge repeatedly often makes the throat more sensitive over time. In some cases, simply reducing habitual throat clearing can significantly improve symptoms, although it usually takes patience because the irritated tissues need time to recover. Another common mistake is assuming that every case of throat mucus is caused by a bacterial infection. This leads many people to seek antibiotics whenever symptoms persist. However, most chronic throat mucus is not caused by bacteria. Allergies, acid reflux, dry air, viral infections, and environmental irritants are much more common causes. Antibiotics do not treat these conditions, and taking them unnecessarily can contribute to antibiotic resistance, while exposing you to potential side effects, such as diarrhea, allergic reactions, and disruption of your normal gut bacteria. Many people also rely heavily on coughs, syrups, or lozenges without understanding that these products are designed to relieve symptoms, rather than eliminate the underlying problem. While they may temporarily soothe irritation, they cannot stop postnasal drip, reverse acid reflux, or treat chronic allergies. This is why the mucus often returns shortly after the medication wears off. Another mistake involves not drinking enough water. Many people underestimate how much hydration affects mucus consistency. When you're dehydrated, your mucus becomes thicker, stickier, and much harder for your body to move naturally. Instead of flowing smoothly toward the stomach, it clings to the back of the throat, creating that persistent sensation of something being stuck. Even people who believe they drink enough fluids may become mildly dehydrated if they consume large amounts of coffee, alcohol, or sugary beverages, while drinking very little plain water. Ignoring environmental triggers is another frequent problem. Dry indoor air, cigarette smoke, air pollution, strong cleaning products, perfumes, and chemical fumes can all irritate the lining of the nose and throat. Some people spend hours every day in environments that continuously expose them to these irritants without realizing their impact. Even if the exposure seems minor, repeated irritation over weeks or months can keep mucus production elevated. Sleeping habits can also play a role. Lying completely flat may allow postnasal drainage or stomach contents to reach the throat more easily, especially in people with acid reflux. Some individuals notice that they wake every morning with coated throat, quent, coughing, or hoarseness because mucus and irritation accumulate overnight. Making simple adjustments, such as slightly elevating the head during sleep when appropriate, may reduce nighttime symptoms for some people. Another mistake is continuing to eat foods that repeatedly trigger reflux without recognizing the connection. Large evening meals, spicy foods, fatty meals, chocolate, caffeine, peppermint, alcohol, and carbonated beverages can all contribute to reflux in susceptible individuals. Since silent reflux often occurs without obvious heartburn, many people never suspect that their diet is affecting their throat. They continue treating the mucus while overlooking one of its most common causes. Some people become so accustomed to their symptoms that they stop paying attention altogether. They assume constant throat clearing is simply part of getting older, or that everyone experiences the same problem. While occasional throat mucus is perfectly normal, symptoms that persist for weeks or months deserve proper evaluation, especially if they interfere with daily life. Ignoring persistent symptoms can delay diagnosis of treatable conditions such as chronic sinus disease, allergies, asthma, or reflux. On the other hand, some people become overly aggressive in trying to remove the mucus. Constant coughing, repeated gargling with harsh solutions, excessive use of nasal sprays, or frequent use of over-the-counter decongestants beyond the recommended duration may actually worsen irritation or create additional problems. More treatment is not always better. The goal is to identify the reason the mucus is present rather than trying to force it away. One of the biggest misconceptions is believing that if you can just get rid of the mucus, the problem will disappear. In reality, mucus is often acting like a smoke alarm. Removing the alarm doesn't put out the fire. The mucus is simply responding to something else that's causing irritation. Until that underlying issue is addressed, the body will continue producing mucus because it believes it's protecting your airways. The encouraging news is that once these common mistakes are recognized and corrected, many people notice gradual improvement. Breaking the cycle of constant throat clearing, staying well hydrated, reducing exposure to irritants, managing reflux or allergies appropriately, and seeking medical evaluation when symptoms persist can make a significant difference. Rather than fighting the mucus itself, the most effective approach is understanding why your body keeps producing it in the first place, and treating that root cause. If you've been dealing with the constant feeling of mucus stuck in your throat, the good news is that there are several practical, science-based steps that can often reduce your symptoms. The key is to remember that lasting improvement usually comes from addressing the underlying cause rather than simply trying to remove the mucus itself. Small daily habits, combined with appropriate medical evaluation when needed, can make a significant difference over time. One of the simplest and most effective places to start is staying well hydrated. Water helps keep mucus thin and easier for the body's natural cleaning system to move. When mucus becomes thick and sticky, it tends to cling to the back of the throat, making it much more noticeable. While everyone's fluid needs are different depending on age, activity level, climate, and overall health, making a conscious effort to drink enough water throughout the day can help support normal mucus clearance. If your urine is consistently dark yellow, it may be a sign that you need more fluids. Adding moisture to the air can also be beneficial, especially if your symptoms worsen during the winter, or while spending time in air-conditioned environments. Dry air can irritate the lining of the nose and throat, causing mucus to become thicker. Using a humidifier in your bedroom, particularly while sleeping, may help maintain comfortable humidity levels. However, humidifiers should be cleaned regularly according to the manufacturer's instructions because poorly maintained units can harbor mold or bacteria, which may worsen respiratory symptoms instead of improving them. If allergies are contributing to your symptoms, reducing exposure to known triggers is an important part of treatment. Keeping windows closed during high pollen seasons, washing bedding regularly in hot water to reduce dust mites, vacuuming with a high-efficiency filter, and limiting exposure to pet dander when necessary may all help decrease allergic inflammation. For some individuals, healthcare professionals may recommend antihistamines, nasal corticosteroid sprays, or other allergy treatments depending on the specific cause and severity of symptoms. Nasal saline irrigation is another option that many people find helpful, particularly when postnasal drip or chronic sinus congestion is involved. Rinsing the nasal passages with sterile saline solution can help remove excess mucus, allergens, and irritants while improving normal drainage. It's essential to use sterile, distilled, or previously boiled and cooled water rather than untreated tap water, as this reduces the risk of introducing harmful microorganisms into the nasal passages. If silent reflux or acid reflux is suspected, lifestyle adjustments can often provide meaningful improvement. Avoiding large meals within 2 to 3 hours of bedtime may reduce the likelihood of stomach contents traveling upward while you sleep. Some people also benefit from limiting foods that commonly trigger reflux, such as fatty meals, spicy foods, chocolate, peppermint, caffeine, alcohol, and carbonated beverages. Maintaining a healthy body weight, if recommended by your healthcare provider, may also reduce pressure on the stomach and lessen reflux symptoms. Learning to resist frequent throat clearing is another valuable strategy, even though it may feel challenging at first. Instead of clearing your throat repeatedly, try taking a sip of water, swallowing gently, or performing quiet cough if necessary. These alternatives place less stress on the vocal cords and may help interrupt the cycle of irritation that encourages even more mucus production. It often takes several days or even weeks for the throat to become less sensitive, so patience is important. Good vocal hygiene can also support recovery. Speaking at a comfortable volume, avoiding unnecessary shouting, and giving your voice opportunities to rest if it feels strained may reduce additional irritation. For individuals who rely heavily on their voice for work, persistent throat symptoms should not be ignored, as ongoing inflammation can affect vocal quality over time. Quitting smoking is one of the most important steps a person can take if tobacco use is contributing to chronic throat mucus. Cigarette smoke damages the tiny cilia responsible for clearing mucus while simultaneously irritating the airways. As the respiratory system begins to recover after smoking cessation, many people notice gradual improvement in mucus clearance. Although this process can take time, depending on the duration and intensity of smoking, it's equally important to know when home care is no longer enough. While persistent throat mucus is usually related to common, treatable conditions, certain symptoms should prompt medical evaluation. If the problem continues for several weeks, despite reasonable self-care measures, it is worth discussing with a healthcare professional. A thorough history and physical examination can often identify whether allergies, reflux, sinus disease, asthma, medication side effects, or another condition may be responsible. You should also seek prompt medical attention if your symptoms are accompanied by coughing up blood, significant difficulty swallowing, unexplained weight loss, persistent chest pain, shortness of breath, a neck lump, or a hoarse voice that lasts more than several weeks without improvement. Although these symptoms are not common, they may indicate conditions that require further investigation and should not be dismissed as simple throat irritation. In some situations, additional testing may be recommended. Depending on your symptoms, a healthcare provider may examine your throat, evaluate your nasal passages, assess for reflux, perform allergy testing, order imaging studies of the sinuses, or refer you to an ear, nose, and throat specialist or another appropriate expert. These evaluations help identify the root cause so that treatment can be tailored to your specific condition rather than relying on trial and error. The most important takeaway is that your body produces mucus for a reason. It is a protective substance designed to defend your airways, trap harmful particles, and keep delicate tissues healthy. When you constantly notice mucus stuck in your throat, your body is often signaling that something else deserves attention. By understanding the underlying cause, making thoughtful lifestyle changes, avoiding habits that increase irritation, and seeking medical care when warning signs appear, many people are able to experience significant relief and finally break the cycle of constant throat clearing and discomfort.